Welcome. My name is Samuel and I will be the representative of 316, working alongside with Michael, Kira, Sabrina, Isabel and Lucy. I will be discussing about Impetigo and covering the causes, symptoms and available treatments. I will also talk about the evidence-based approach that is needed for parents and caregivers when treating an individual infected by Impetigo. So, what is impetigo? Impetigo is an extremely contagious bacterial infection that affects predominantly the facial region, but also has been known to occur on other skin surfaces around the body. Due to the contagious nature of the disease and the fact that it is most prevalent in children between the ages of 2 to 6, impetigo spreads rapidly throughout young and early childhood schooling institutions. For this very reason, impetigo is commonly known as school sores. Although rare, impetigo is not limited to children alone, but affects the adolescent and adult population. For your information, there are two forms of impetigo which will be touched upon next. So we now know that impetigo is an extremely contagious disease, but what causes it? To understand this, we must first establish the differences between non-bolus impetigo and bolus impetigo. As provided by Image A, non-bolus impetigo is characterized by multiple smaller and yellow crust-like appearance and occurs in 2/3 of cases. Image B, bolus impetigo, is characterized by larger pustule blisters that usually affects the face, trunk, buttocks, and groin area. There are two bacteria that instigate infection, Staphylococcus aureus and Streptococcus pyogenes. Bolus is caused by Staphylococcus aureus only. Non-bolus is caused mainly by Staphylococcus aureus, however can also be affected by Streptococcus pyogenes by either isolation or as a combination. If you're still wondering what impetigo looks like and how you can identify it, the Departments of Health Western Australia compiled a list of symptoms including itchiness, redness, formation of blisters around facial extremities such as the nose and mouth, which can later burst oozing yellow sticky fluid which dries to form a crusty, unsightly appearance. Subsequent scabs also form that are involved during the healing process. A larger scale of infection of the skin, however, can lead to a more serious additional symptoms such as fever, swollen lymph glands, and malaise. Although this information is useful for diagnostic reasons, symptoms of infection are only present 1 to 3 days after contracting the infection itself. So, if you or your child has been diagnosed with impetigo, how do you treat it? There is an arrangement of treatment options available, including topical antibiotics, oral antibiotics, and antiseptic creams. If in the unfortunate position where the option of treatment is not an option, the skin disease can resolve itself, but that is extremely unlikely. Serious negative consequences of inaction are a result of leaving the infection untreated, including kidney malfunction, psoriasis, osteomyelitis, pneumonia, and acute glomerulonephritis. How would someone go about administering treatment to someone with impetigo, and what does the evidence say? If symptoms arise, the infected individual should be taken to or seek out a general practitioner and be diagnosed properly. There, they will most likely be prescribed topical antibiotics if the symptoms are not too severe. If an adverse reaction to the treatment is experienced, oral antibiotics are recommended. Evidence shows that topical antibiotics are to be more effective than topical placebos, proving that they can play an important role in the treatment of the infection. However, some individuals do not have the tolerance towards topical antibiotics or have a more progressed disease, in which case oral antibiotics are recommended. Thank you for listening. This has been Samuel from Group 316 on the topic of impetigo. Thank you.